If you only have 5 minutes, then you won't have time to fully appreciate what is happening here inside this health clinic in Pensacola.
Which I didn't even know I had.
That certainly is not enough time to tell you about people like Freeman Scott. He is a cancer survivor that would not be sitting in this chair today if he had not found this Health and Hope clinic.
Turns out I had a 5-centimeter tumor in my left kidney. And it was very close to getting into the lymph node. And we were able to remove the mass, and they put me in immunotherapy. I was in immunotherapy for over a year. And since that time, I've been cancer-free. I'm going, I think it's my 3rd year in March. When I go for my next scan, hopefully it will come up clean and we'll be okay.
There is no doubt in Freeman's mind that if he had not found the Health and Hope Clinic in Pensacola, he would have also lost his life.
I can tell you without a doubt, I wouldn't be sitting here had I not been able to get that health care through this clinic. This clinic saved my life.
And his story is not as uncommon as you might think.
I needed to have a hysterectomy. I had something on.
Then there's Darlene Kirby and her husband Gerald, who are preachers of the gospel at a local church where they proclaim the word of Jesus to the homeless, they themselves without health insurance.
And a lot of the time that you work, you're working for your health insurance, right? So it's a wonderful testimony to the Lord that He's moving through people who want to give, who see these people who are in that predicament that according to mankind or whatever they say, you don't fit. Because according to them, we don't make enough money to make or get insurance or any of those things. So we do kind of fall through the crack, but the Lord said, no, we'll just fill that crack with health and hope.
$2,400 a month.
Randy's husband served our country in the military, but when his duty ended, they were told it would cost them $5,000 per month to pay for their own insurance. They simply could not afford it.
A month to be able to do that. I mean, that's every single month. And I'm just like, I can't.
They do take care of her really good when she needs it.
No, I mean, medication costs are ridiculous.
One of the drugs in the clinic pharmacy costs $10,000, but it costs nothing to the patient who needs it. All because of hundreds of thousands of dollars in grants, financial support of the business community, and private donors who care about the people who come here for help. Not to mention over 400 volunteers who spend their time for free to care for the patients who have nowhere else to go. But that is not all the patients here receive. They also learn about the love of Jesus.
You can have hope, and that even though life can be tanking around you, if you got Jesus Christ as your Lord and Savior, you got hope in your heart, and that gives you a reason to live right there.
Sitting in the waiting rooms are spiritual encouragers who offer to pray for and with those that are sick and hurting.
I know what we're doing is changing this community every single day. A lot of people are working, but let's say they work for a small business. They work for a restaurant downtown, and they're waiting tables. So that small business can't afford to pay for their insurance, and so they're working, but do they have enough to buy a $1,000 a month insurance policy? No, they do not.
Every day is rich with an opportunity to touch a life. And what better way to advance God's kingdom work than to take our own personal circumstances? It's our skills, talent, God-given talent, it's our financial wherewithal, it's our careers, and we use that and dedicate that to touching the lives of individuals.
We've not had to turn away patients because of finances, because of not having the staff. It just continues to speak for itself. It's awesome.
I think most of them you would find that people say, the clinic saved my life. Thank you. for saving my life. Thank you for helping me through a really hard time in my life.
And I wish I could do more. And hopefully this interview will inspire some people to give, to support, either money, time, it doesn't matter, to help this facility and others like it flourish, because we need it, we really do.
This setting helps you provide more comprehensive care, which it's more rewarding when you can take a patient and try and restore their health so that they can get a job or recover from addiction problems that they've had in the past. Or some of the patients even have been abused, or, you know, some are immigrants and they're trying to get their foothold here in this country. And so, you know, it takes wanting to serve, you know, and help other people. Making sure that we can help a person to hopefully turn their life around, or to be able to go out in public and smile like they haven't been able to do for a number of years because this tooth had a big hole in it in the front or something like that. Sometimes it's the simple things.
And sometimes it's just having hope.
If this was not here, I don't even want to know. Like, I think this clinic has just such a huge impact. We probably would just see more and more people on the streets, or just like, I feel like maybe the average person, they don't really encounter this type of like niche problem, if that makes sense. And so I don't even want to think about the idea of this didn't exist, because it just gives so much.
Every dime that we get locally means more to me than anything, because it means that people are watching and they see what we're doing. It's pretty amazing.
Yes, we understand that you are busy with your own lives, and we are so grateful for these 5 minutes of your time. But imagine, 5 minutes is 5 minutes more than many of these patients would have had added to their lives if they had not found Health and Hope Clinic. Please do what you can to keep this place and these patients alive 5 minutes longer. The full story of the Health and Hope Clinic and personal testimony from patients and volunteers can be found on their YouTube channel. God bless you.